Hi, welcome to Discussions with Dr. Dean. I'm Dr. Rachel Dean, and today we will be discussing hair loss. This is a common concern I see from patients, which is why I chose it as our topic today. There are two pretty common types of hair loss that I see. One is called telogen effluvium, which is an excessive shedding of the hair. It can be related to a major stressor or pregnancy, illness. I've seen this quite a bit in patients who've had COVID, and a few months later they develop a massive shedding of their hair. Another really common type of hair thinning I've seen is something called androgenetic alopecia, which alopecia is just a general term, which means hair loss. So this androgenetic alopecia is related to your genetics, but also is related to hormones. But you can also see hair thinning not just related to your own internal source of hormones, but also if you're taking an exogenous source of hormones like the BioT pellets. I've seen quite a few patients develop hair thinning on the scalp and then hair growth in other areas. Malnutrition is another cause for hair thinning or malnourishment, also vitamin deficiency. More recently, I've seen patients hair thinning related to the semaglutide injections, and it's unclear whether that's just from malnourishment from not eating or if it's related to the medication itself or a combination of both. But medications can definitely cause hair thinning. There are other types of hair loss or hair thinning that are inflammatory. There's one called alopecia areata, which is an autoimmune type of hair thinning. Basically, one's immune system attacks the hair follicle and it causes the hair to fall out. There have been some really good medications that have come out recently. I say recently, over the past year or so, to treat that autoimmune type of hair thinning or hair loss. And then there's a whole group of alopecias that are inflammatory, and so that means that there's inflammation around the hair follicles, and over time inflammation can lead to scarring. And so it's really important to diagnose these types of alopecias early, because once the hair follicle is replaced with scar, you can't regrow hair from it. So we are actually running a special this month on hair loss, our hair vitamins, because I've seen hair thinning as a concern so much here lately. And so we're really encouraging patients to come into the office. We're experts not only in skin, but also hair and nails. Let us do a history, physical exam, formulate a differential diagnosis of what type of hair loss you're having, whether it's just one type or a combination of different types. We might end up doing a biopsy in the office, which is a procedure where we take a little sample of the skin and the hair follicles, which can give clues as to what type of hair loss is going on. If it's an inflammatory hair loss or an autoimmune type of hair loss, you can see that on the biopsy. So that's very helpful. And we may also draw some blood work in the office. You can check for vitamin deficiencies and anemia, which those can be contributing factors as well. In addition to that, there's a whole slew of medications that can be used to treat different types of hair loss. And like I said earlier, there's no one treatment that's going to work for alopecia areata or autoimmune hair loss that's also going to work for telogen effluvium or shedding of the hair. So it's important to get the correct diagnosis so that you get the right treatment. There are some treatments that are not prescription medications. There's one in our office that we do. It's a procedure called PRP scalp injections, which can be helpful to stimulate hair growth. And then, of course, there are, like I mentioned just a minute ago, the vitamins, the Nutrafol vitamins. These vitamins have studies that actually show their efficacy. So we started carrying them in the office, and I take them myself. So this month, our special is the first month of Nutrafol vitamins is 50% off or half price. If you have any concerns on any of these things or questions, please just call us, make an appointment. We're happy to see you. I'll see you next week.